Member for Haldimand Norfolk. Next question.
Thank you, Speaker. My question is to the Premier. There are 2.3 million Ontarians currently without a family doctor, and no admission from this government that this province is headed into a perfect storm. Monday, the Health Minister, in response to a question, suggested the member sit down with hospital CEOs to learn the truth. I've sat down with hospital CEOs, and they are clear that healthcare in Ontario has never looked as grim as it does today. Last week, I was contacted by a mayor, represented by a government member, who said in the near future, 1/3 of the population this mayor represents will be without primary care. We are desperate now, this mayor told me, and yet the minister is on record as saying recruitment and retention of doctors in Ontario is not a major concern. Speaker, through you to the Premier, if 2.3 million Ontarians without a doctor, or 1/3 of a town's population without a doctor, is not a major concern, then what constitutes a major concern with respect to health care in this province?
The Deputy Premier and Minister of Health.
Thank you, Speaker. I want to remind the members of the investments that our government has made under the leadership of Premier Ford. In February, we announced expansions and new 78 primary care multidisciplinary teams. What's happened since February, Premier or Speaker? Couchiching Ontario Health Team is already taking on new patients. Barrie Area Native Advisory Circle is already taking on new patients. Unison Health and Community Services in Toronto is already taking on new patients. And it goes on and on. In Kingston, in Minto, Mapleton, in Lambton, we are making progress. We see, for 2 years in a row, a historic registering of both nurses and physicians in the province of Ontario. Why? Because people want to live here, they want to work here, and they want to practice medicine here. Thank you.
Supplementary question.
Thank you, Speaker. I'm baffled. More and more money being thrown at a system that continues to fail. It's clear healthcare needs a major rethink in this province. Otherwise, I can't help but think that this crisis is a means to an end. I was on a call recently, and there were government members also on that same call, where a mayor expressed frustration that this government expects him to welcome more and more people through new builds, and yet his local ER is constantly shuttered. If everything is fine, why are 2.3 million Ontarians without a doctor? Are the hospital CEOs not telling the truth? Are the mayors I speak to being dramatic? What about constituents lining up for hours at walk-in clinics or at ERs? Are they faking it? And why are there thousands of Ontarians set to converge on Queen's Park tomorrow for a healthcare rally? Ontarians need a doctor, not rhetoric.
Question.
Speaker, again through you to the Premier, who is telling the truth, this government or the very people who rely on an ailing system each and every day?
Minister of Health.
Perhaps it would help the member opposite if I shared some facts with her. So in the last year, we've had 17,000 new nurses registered to practice in the province of Ontario. We have had 2,400 new physicians registered to practice in the province of Ontario. We've worked with the midwives. We've worked with nurse practitioners. We've worked with nurses to make sure that we increase their scope of practice to ensure people have access. But I think that the most important thing that we are doing is actually building our healthcare services through the students, through the young people. A new school for medicine in Brampton will be taking students on in September of 2025. In York Region, a brand new medical school that will actually focus on family medicine. We are doing the work. There is more work to do, but we're getting the job done. Thank you.